Hi, everybody. You are in for a treat today because we have a very special guest with us, unlike any of the guests we've had before. We have with us Dr. Daniel Kaufman from Miami, Florida, and Dr. Kaufman is a plastic surgeon. And as you and I both know, when you lose massive amounts of weight, regardless of whether it's from bariatric surgery or having a GLP-1 or from whatever other reason you've lost a lot of weight, there are skin issues. And so Dr. Kaufman has a very busy practice in Miami where he does post weight loss skin removal surgeries. Welcome, Dr. Kaufman.
Thanks, Dr. Stapleton. Always, it's a pleasure to be with you.
Well, I'm telling you, this is going to be a pleasure for our listeners because usually I'm into these deep psychological topics. And so this will be something that almost every single person who listens to the podcast can relate to, and you can answer some really important questions for them. So,
I'd be,
how long
be
have
happy.
you been doing weight loss, skin related procedures?
Well, yeah, so let's just define my practice is everything from the neck down. I'm a body contouring guy. So I do a lot of
Excellent.
high def liposuction. I do all the different body parts that people would think of generally as plastic surgery, like tummy tucks, cosmetic breast surgery, augmentations, reductions, lifts. Um, all the different kinds of tummy tucks. Obviously, that comes along with liposuction, but in different aspects. But also a lot of other kinds of body contouring, like total body lifts, arm lifts, thigh lifts, mommy makeovers, all the combinations of the different surgeries that we can do together. And one of the
Fantastic.
big things that I've gotten into in the past few years is plastic surgery or body contouring after the massive weight loss. And as you said, there's massive folds of skin in virtually every aspect of the body, and it's actually very different than the other kind of things that I've done in the past, because you need to now think of the different kind of the different approach to post-massive weight loss to the post-massive weight loss patient than you would any other kind of plastic surgery, what people would consider the classic kind of plastic surgery patient. So yeah, that's been going on for the past few years, and obviously with the Ozempic boom and the the constant rise of bariatric surgery, and not only that,
Right.
but bariatric endoscopy. Now there's so many methods to lose weight, and it seems like it's more available than ever before. So that kind of branch of plastic surgery, that post massive weight loss body contouring, I think is obviously burgeoning right now, and will likely take over so much of plastic surgery in the general sense. So get ready for it.
Right, and I think that's true because I recently, like this last week, read that 73% of the American population is now either overweight or obese. So, and I know people are working really hard and want to get healthier and live a more active lifestyle and just be healthier in general. So, with these weight loss methods that are very effective for people, a lot of people do have struggles with the skin after surgery. So, it's so great that you are available to help with these things. Let me ask you a question about how does an insurance company decide? So somebody's lost a lot of weight. How do they decide what's medically necessary and what is not? Like, I've heard all kinds of different things. Some people will say they had their arms covered by insurance, but I've not heard that very often. Whereas obviously the waist causes all kinds of rashes and things. Is that how they determine that?
Yeah, so that's a very gray area in plastic surgery in the general sense, and specifically as it relates to the body contouring surgery. So I'm going to say something a little bit revolutionary, or I don't know if it's controversial or not, but get ready for it. Here it is.
Okay.
So your healthcare insurance company doesn't care about your healthcare, and their responsibilities are for their shareholders to make a penny, to make to make money. So a lot of times, what they would do is they would actually be an impediment or prevent a lot of care from being covered. And there's no shortage of horror stories of what insurance companies have done with their patients over
Correct.
the years. Now, having said that, the way that they do decide whether something is medically necessary or not is whether there's a medical indication for the procedure. You mentioned that, yes, there are some situations, let's say in a breast reduction, where the size of the breast is so large that it causes back pain, shoulder pain, bra strap grooving that you can see, prevention of
Mhm.
women from getting self-examination or even examination by other doctors for breast
Sure.
cancer and so forth. So that would be inclined, the insurance company would be inclined to pay. Another example that comes to mind is the rashes and chronic skin infections, like what we call intertrigo and paniculitis, just some
Mhm.
fancy medical terms for those chronic skin conditions that happen, let's say, because of the fall over of the abdominal skin that remains in the front. Some people will call it the beer belly, the apron, or the kangaroo pouch, or whatever other
Right.
funny name people have come up with their body parts. So in those situations, yes, you would be likely to get the insurance company to cover for it. However, the insurance company is very stingy with what they allow to get done.
For sure.
For example, if they allow a procedure called paniculectomy, which is just cutting off that bottom portion of the skin between the umbilicus or the belly button and the mons pubis, which is the area overlying the pubic bones, they would just cover for just removal of that, but they wouldn't cover for any of the other body contouring maneuvers that we would do. Let's say the muscle repair or the diastasis repair on the inside. That's what helps tighten up the tissues on the inside and finds that silhouette within a tummy tuck, for example, or the
Mhm.
liposuction on the flanks and the abdomen, or most importantly, the transposition of the belly button so that it looks
Wow.
great and not only just accomplishes the
Right.
job of getting rid of the excess skin. So the
Huh.
insurance companies are going to be very reluctant to pay for any of these things. So some coverage can be obtained, but until then, buyer beware. You got to be an educated consumer of this kind of healthcare and really go out and ask the pointed and directed questions from the insurance company, however much you're able to do that, because again, they have armies of people in all kinds of positions to fill in the gaps when you try to get in touch with them. But it's up to you as a consumer to figure out just how to make sure that we can get these operations paid for. But here's the good news: there's lots more people who are losing massive amounts of weight. With that, there are lots more plastic surgeons, board certified plastic surgeons like me, who are experts at doing this and do a lot of these procedures. I mean, I'm almost in a kind of a little bit of a club, of surgeons who end up doing so many of these body
Yeah.
lifts and breast lifts and all the combinations thereof. And we talk to each other on the internet. We're on our Instagram pages and we kind of tend to follow
Right.
each other. And the knowledge base is improving so much that the options for patients these days are greater than ever before, which means costs go down. Today, body lifts and these other, like I said, post massive weight loss body contouring procedures are more affordable than ever before, even obviating the need for any kind of insurance, health insurance coverage, for good and for bad, of course. So, paniculectomy is an operation that it only removes the excess skin between the umbilicus or the belly button and the pubic region, or the hair bearing portion that or skin that lies over the pubic bone. So that operation is actually a terrible operation because it doesn't let the surgeon perform any of the other essential elements to the better procedure, which is what we'd call an extended tummy tuck. So an extended tummy tuck
Extended
is,
tummy tuck.
yeah, the extended tummy tuck, as I was saying, is the quintessential procedure that any board certified plastic surgeon has to learn how to master in their plastic surgery fellowship. But especially and specifically for the plastic surgeons who are interested in helping out the massive weight loss community, that is the operation that basically undergirds all of the other core body contouring operations that we can talk about, and we can elaborate on what those are. But first and foremost, we should explain in detail what the extended tummy tuck is and how it differentiates itself from a paniculectomy.
Perfect. Go for it. Give us all the
All right, so the,
deets.
the deets, as the young kids say out there, right? Or I'll spill the tea, or whatever the idiom is
Yes.
these days. So an extended tummy tuck differentiates itself, let's say, from a regular tummy tuck by not stopping at the iliac crest. Now, the iliac is that bone of the pelvis that's on the side that gives the pelvis kind of its basin shape. Everyone can, all the listeners and viewers, you can take a feel of, right at the side of the hip, feel for that little bony prominence there. That's called the anterior superior iliac spine. Fancy words for that little point where it defines the abdominal cavity essentially, and defines the extent of a regular tummy tuck. So an ellipse shaped a portion of skin would be excised between those 2 points and the belly button and the pubic region. Now, the extended tummy tuck, we do a bunch of stuff on the inside, which I'll explain, but these days, it's not sufficient enough in so many patients, and especially in the massive weight loss patient, to end
Right.
the operation there or finish the incision there. Why?
Right.
Because you still have a lot of excess skin on the sides going around the hips. Now, again, to the viewers and the and the watchers, or the viewers and the listeners, take a good hefty pinch of your, of the skin on the side, the skin and fatty tissue, and not just a simple little, a pinch like there, but give it a whole hefty handful. If you can pinch a good, decent amount of skin and excess fatty tissue that's several inches wide, the correct operation for you would be an extended tummy tuck rather than just a simple one. Now, the rest of the elements of that operation, we do aggressive high definition liposuction on the flanks, on the sides, and also on the upper abdomen. And we have to do it obviously judiciously, so that when we do the transfer of the tissue, that's to say pulling down the upper abdominal flap down to meet the bottom, so that the two incisions meet to close the actual wound, then we get it just right, and that we don't cause any problems later on. But again, that goes into the art of actually performing a tummy tuck.
Right.
Now, on the inside, what we do is we release the root of the belly button. If you can imagine, on the skin of the belly button, we would cut around it and leave that root behind. Then we would take that upper abdominal flap and pull down, so that the incisions that we made, defining this ellipse-shaped portion of skin that we take away, then it would close in a perfect smile orientation. We deliver the root of the belly button through a new hole that we make. We call it a
Mhm.
neo-umbilicus in the upper flap that we've pulled down. What
I
remains
love
is
it.
that beautiful smile shaped incision that goes from all the way from one hip to the other, and even continues along the side of the hip. Now, this smile has to be a perfect smile, and it has to always fit under a bikini, and not just
I
a
love it.
big grandma bikini, if we could say, but we could say that, well, these are my patients' words, not my own. But we could fit the scar under a teeny weeny bikini or sexy lingerie.
I love that.
Now that's the essence of that. Now then we have to add a new little scar on the inside of the belly button. And we do it so neatly these days. We trim it up and make sure the scar goes deep inside that belly button, so that
It's
a tummy
amazing.
tuck, once it's done correctly, and yeah, and we've advanced so much from the days when even I was training in plastic surgery about 1,000 years ago, that we've gone so much into making the scars so inconspicuous, so perfectly placed under even the most revealing of clothing, that man, it's a wonderful operation. And when done in trained hands and people who've done a whole bunch of them, then yeah, you could get amazing contouring results and get that pre-obesity, pre-baby body back. It's amazing. The extended tummy tuck is just the quintessential procedure. By the way, add to that, actually forgot just to go back into it. On the inside work, the so-called under the hood, we also
Right.
do the tightening of the musculature. A lot of women with pregnancy or with obesity as well, and it happens in men as well, we have a separation of the
Right.
abdominal muscles. Remember, the abdominal wall is actually a confluence of muscles and connective tissue layers that come together to form essentially a barrier of, the insides where all the organs are held, like
Right.
the liver, the intestine, the stomach, the spleen, kidney, and a bunch of others, from the outside environment, of course. So they're held within the abdominal cavity by the abdominal wall. That abdominal wall can sometimes spread, and we consequently have this kind of bulge in the midline. That's called the diastasis rectus. Again,
Hmm.
fancy little Latin words, but it just means those separations of the muscles. And we could see that in the OR. And anyone's who, if you're not afraid of the gore, you can log into some of my socials. You'll see a bunch of that stuff. I actually love taking video and pictures on the inside of the OR. I just tell my nurse, grab my phone,
Yeah.
and that's been immediate these days. It's amazing the technology that we can use at our disposal. And I
Did that
actually show
totally
people. Sorry.
Did that totally freak you out the first time you saw the inside of a human body?
And actually, no, not at all. I felt at home. I mean, we could get into that, but yeah, I always felt home in the OR and the cadaver lab since even
Wow,
my.
that's
I mean, we're talking
thank
about
God
from
there are
20 years.
people like you. I'd be the one passing out on the floor,
Yeah, that happens sometimes.
I'm
Every now and then,
sure.
a medical student that's destined for psychiatry ends up falling in the OR, and
Yep.
hopefully,
I worked at a medical college, and I saw the medical students for therapy. It was great. I loved it. It was my
yeah,
such a great job.
yeah. But no, just back to the just the diastasis repair there. I love to show people the under the hood work where they actually can see that I draw out the extent of the separation of the muscles, and
Mhm.
then I show them with a side by side of after
Wow.
having sutured it together, what we call the rectus plication, which
Right.
is a multi-layered closure of that separation, the diastasis repair, which we put together, and that goes miles towards flattening out the abdominal musculature, really tightening up and snatching up the waist, really finding that
Huh.
silhouette that you have there. And it's just an amazing part of the extended tummy tuck. Now you go back to the scar, that smile of a scar. It has to be beautifully super low, so that really it defines that mons pubis, or that sort of triangular hair bearing skin at the front,
Mhm.
as part of the skin overlying the pubic region there, which ends up looking amazing these days. I'm telling you that we're not doing your grandfather's extended tummy tuck these days. It's been refined on many different levels, and the results that I and some of my colleagues can get today are just
That is
amazing.
so exciting for people. Carrying around that extra weight and then that extra skin, miserable. So to know that this is an option and available and it is so precise now, what a great opportunity for people.
Yeah, better than ever. Yeah.
Do you have recommendations if people come and see you and you're like, "Oh, you need to wait until you've lost a few more pounds," or how do you decide that?
Yeah, so there's many different guidelines out there on who's ready for surgery, and
Mhm.
they've also been refined over the years. The more we deal with a population of people who've lost massive amounts of weight, let's say 50 pounds, 100 pounds, or 200, or even more. If you could imagine someone having weighed 400 or 500 pounds, and then they come into your office when they
Right.
weigh 190, and flaps of sagging surplus skin hanging around
Mhm.
everywhere, and it's amazing. But then again, we don't only see people like that. I see plenty of people who are still on their weight loss journey, who are at BMIs that, well, maybe my old professors wouldn't have taken them to the OR, because they would say, yeah, you got to lose some more weight, or improve your overall physical condition in many ways. But a lot of those criteria have been refined, because we've now realized that even if you're not quote unquote ready, in the sense of, let's say you would be considered over, let's say, 20 years ago or so,
Mhm.
these days we realize that doing some of these body contouring procedures during a weight loss a journey
Mhm.
actually help contribute to further weight loss. And they help the patients in staving off obesity recidivism, or regain of weight, which is something that so often plagues people who've lost massive amounts, or even smaller amounts of weight. I mean, take a look at how many of the listeners or viewers right now could attest to, I lost 20 pounds. I was excited after New Year's. I got a new gym membership, and I was really good with my diet, and I prioritized protein and watched what I ate. But then by the time March and April came around, and then
Right.
something happened in May that I lost my job, or I had another stressing life events, and next thing you
Right.
know, I'm back to December again, and man, I weighed even more than what I did the year before.
Yeah.
So it gets very discouraging for so many. Now, there's already been statistical evidence, statistically significant evidence, to show that when you do those post massive weight loss body contouring procedures, let's say an arm lift, a tummy tuck extended, or a body lift, a thigh lift, then you actually, it's a self propagating prophecy there. You like what you look like in the mirror a lot more than what you did
That's
before.
right.
All of a sudden, you find that it can motivate you and catapult
Yes.
you into redoubling your efforts or even doing things that you weren't doing before. And
Mhm.
that's why, I've adjusted a lot of my, let's say, selection criteria. I've gotten
Right.
a lot more accommodating to people with higher BMIs. Obviously, we want to take someone when they're, going for surgery. People always ask me, "Hey, doc, how many more pounds I got to lose to get on your
Right.
table?" Or if they've made a date already that fits into their life logistics, which we also have to consider as a
For
big
sure.
part of body contouring surgery, because you can't just go to you can't just do it over a weekend or
Lunch break.
lunchtime. Yeah, lunchtime lipo, as they say. No, these are major commitments in people's lives, and you have to adjust the logistics and everything, the finances, the school, the kids, the in-laws
Right.
coming in to help, and all these things have to be accounted for. So we have to be more accommodating to our patients. And much like myself, there are many other board certified plastic surgeons, body contouring experts who
Right.
will have more leeway in working with more patients, maybe higher BMIs. But I always tell my patients, look, this is the best plastic surgery is done when it's a teamwork effort. I do the
Right.
hard work in the OR, you do the hard work outside the OR. And if we can combine efforts like that, man, the sky's the limit. You can reach your body's full potential, look even better than you did in your
For
20s.
sure.
Or, yeah, I've seen just some
Yeah.
incredible transformations.
I know, I have too, and I think it makes me joy-filled to see people regain that confidence and that self-esteem, and like you said, you'll do the hard work in the yard, then they gotta go out and do the hard work, meaning, do the walking or the lifting or the whatever it is to maintain that transformation.
Yeah, absolutely. It's all about creating those habits, and wherever you are. If you've lost weight, I see people in so many different parts of their journeys when they've reached certain plateaus, and yeah, I can't lose any more, doc. I need something here and there, and I find out actually that a lot of times that plastic surgery procedure is the kind of motivating factor, just another
Right,
boost in their
right,
journey, and all of a sudden, people who thought they plateaued out at a certain weight or couldn't improve their daily habits, because it isn't it's a disease of daily struggles, daily fights that
right,
you have to win, even on
right,
a moment by moment, hour by hour kind of a basis.
for
And
sure.
I found that a lot of people, if they use plastic surgery in the correct way, then man, plastic surgery is an integral part of healthcare. And who knew it, that it's such an important part of dealing with the biggest disease of that the world has ever seen, obesity, and all of its related comorbidities, from mental to physical to high blood pressure, the sugars, the sleeping aspects, the musculoskeletal effects. It's just obesity hits every aspect of overall health. And lo and behold, the plastic surgeon is intimately involved. Who would have thunk it?
Who'da thunk it? And I think it's amazing. So let me ask you a question related to that, which is patient expectations.
Yeah.
So how do you talk to patients about their expectations before they have surgery?
Two ways: very, very honestly, and very, very
Mhm.
carefully.
Mhm.
The honest part is this: you have to just put it all out there. There are, of course, plenty of risks in doing this kind of surgery, or any kind of surgery for that matter. Remember,
Correct.
I have to remind people that people telling me, "Oh, I need this something done. I need it. I need," and I get that, and I can appreciate using those particular words. But I
Right.
always have to remind people that this is elective healthcare after all, and the insurance companies will definitely see it that way. They'll be the first one to
That's
say that
right.
this is surgery that you want rather than that you need. Now we
Mhm.
can argue till the sun goes down about that, and I kind
Right.
of like to, and I love to nuance it, as much as anyone. But after all, if you're picking the surgical date, if you're picking the location, if you're picking the surgeon, and you can strategize and plan, then this is a wholly different operation than, for example, one that you would have after experience, God forbid, a gunshot wound, or
Right.
God forbid, having been diagnosed with a cancer, colon cancer, breast cancer, pancreatic cancer, just to name a few. And not that there's no choices in the matter at then, but well, the clock is ticking and you got to make choices quickly, and a lot of them get made for you. But
Right.
those are situations that obviously are kind of self-evident. Now, with regards to post-massive weight loss body contouring surgery, you can choose all those things that we just mentioned. You can choose what to do, where to do, when to do, with whom to do. So all these
Correct.
things are at your disposal, and it behooves you as a consumer to of this elective kind of healthcare to make the best choices for you in your life. Now, you're not out there on your own. There's hopefully people like me who are ready, willing, and able to guide you along and help you make the best choices. And again, there's no shortage of ways out there to figure out just how to do that. But it does require a lot of motivation and
Hmm.
kind of a self-starting, because it's got to be you who goes on the internet and searches and hopefully
That's right.
finds podcasts like this that are willing to talk about it. And I commend your efforts on bringing. Yeah, I'd like for me, I feel like I'm shouting from the rooftops, and I still see it as so underutilized in the
Uh-huh.
things that
I
we can
agree.
do, and in letting people know about this. So good on you, Dr. Stapleton, for bringing this topic out there, because it's so important to people. Now, managing expectations, yeah, that's something that we kind of have to do in terms of being honest with the patient, discussing all the risks, the benefits, of course, the alternatives that we have out there. So as physicians, we always have to be honest and laying it all out there and making
Right.
sure that we're giving the patients the best tools with which to make the best decision. Now, the other way I said in two ways: honestly and
Hmm.
carefully. What I meant by saying that is that you have to be very aware of the sensitivities of it all. I see patients in such mental anguish and such hardships, and even the ones who have managed to overcome those hardships, they're never quite out of the woods, because there are so many difficulties in getting to lose all that weight, and just in
Yeah.
dealing with obesity and all of its comorbidities on a daily basis,
Right.
that when you're a plastic surgeon that deals with this kind of disease, with these kinds of struggles that people have, you have to recognize the very sensitive mental health aspect that
That's right.
invariably are just permeate every single situation, and every patient's got a story, and so many of them are inspiring and heartwarming to me. I keep telling my
Right.
patients, especially the ones who have lost massive amounts of weight, I keep telling them, I say, you're the reason why I went into plastic surgery, because I get inspired by my patients. I'm motivated by them, because they've shown both myself and so many others, the people the naysayers,
Yes.
the
Yes.
negative people who have who just say, well, no, I can't do it, doc. I've tried so much and so hard, and nothing works for me. And when I do meet those patients who do manage to lose weight, and who manage to beat the recidivism rate, which is quite high in obesity, and I say, on the inside, I'm just looking at them and smiling and say, you know what? I wish I could just bring you along to every consult, to every patient who told me that they can't, every patient who painted such a bleak, dark picture.
Agreed.
And I wish they were with me, and then to say, no, 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 you can do it. It's just you just didn't find the right way. How you just haven't found something that clicks for you.
That's
Like that
right.
old Thomas Edison line. When he
That's
tried about
right.
1,000 different ways
That's
to
right.
create the incandescent bulb.
That's
And
right.
when he finally made it, some reporter, I think the old story goes like this. So the reporter asked him, well, how did you not give up? You failed so many times. And he said, well, I didn't fail those 1,000 times. I just showed 1,000 different ways
It
with which it cannot be
didn't
done.
work. Yes. I love
Yeah.
that too, and I use that regularly. So true. Yeah, and this is exactly what this population needs to hear. Not only what you're sharing about the surgery options, but also the mindset that goes with it. Yep. Find the way that does work, and find the people that are living proof of that. So I love that.
Yeah, yeah, and it's nice also. We're getting into a little bit before about the how technology has increased awareness, increased our abilities to explain things to people. I mean, just going back to the me taking pictures in the OR and showing
Right.
people what the work under the hood, which some people have this kind of reaction, to the, like, kind of almost like when you drive by an accident, you just kind of have to look. But
Right.
additionally, with all those improvements in technology, people today can share their stories. They have
Right.
There's all these support groups on the internet. You can communicate with doctors today, with their the coordinators or their staff, and there's all kinds of different associations of people who are looking to get these things done, who have done them. Again, going back to, there are people like you and me who are talking about it online. And when you get into all those aspects of how to be able, how to get started with massive weight loss, and not only the plastic surgery of it all, but in the general sense of, well, how the heck do I lose weight? Where do I even start? I've failed so many times. I'm a hopeless case. I can't do it. Where do I go from here? If you've reached rock bottom, it's the only way to go is up. You just got to look
Exactly.
up and start the climb, start the journey. And it's as the old saying, there's a few versions of this. Rome wasn't built in a day, right? Every step,
Mhm.
every great journey begins with a single step. So
Exactly.
if you do that, and these days there are more options for you than ever, you just got to go out there and grab life by the horns.
So, what do you tell patients who want to have multiple procedures done? Like, I want to come in, I want you to do my arms, I want you to do my belly, I want you to do my thighs, and while you're at it, why
Yeah.
don't you do my toes?
Right. You forgot the neck, of course.
Of course.
Right. But well, it's so much to say about this, and so little time. But all right, let's start with this. I've dedicated my professional career in these days, to ambulatory surgery. What does that mean? It means surgery that you can get in my office, in my fully accredited ambulatory surgery facility, just like a mini hospital, and you can walk in and you can walk out that same day.
Wow.
Meaning, yeah, I know. Tell me about it. Yeah, because this
Wow.
wasn't even a thing when I was a medical student way back when, and we're doing so much these days. Again, just a testament to the incredible advancements we've had in this field. But the whole point of ambulatory surgery is that it's so much better, it's so much safer, it's so much more cost effective for the patients, that it's better than doing surgery in the hospital any day of the week. For a few of those reasons. Let's go over those a few. Number one, it's safer because you're limiting the amount of surgery that you can do. I rarely do surgeries these days that are more than 4 hours long. I get even a full body lift and maybe a little fat grafting
Wow.
in the buttocks with that. That takes me three and a half at most. A mommy
Wow.
makeover these days, let's say a combination of an extended tummy tuck and, let's say, a breast reduction or breast lift or any other combination, that would take me three and a half hours, maybe four at most.
Wow.
So doing these massive combinations, and as you mentioned, the arms and the thighs and the breasts and the tummy and this and that, that's too much. I can do 8, 10, 12 hours of surgery on my feet. Believe me, I've had plenty of training in doing that. But what's it doing to you as a patient? How are
Mhm.
you going to be able to handle that?
Right.
Likely you won't be, and it's not going to be a fun recovery. And you're going to have to stay in the hospital, which is when the bills go up as well. So let's talk about, again, the safety. When you're doing a limited amount of surgery at any one point, making sure that the patient can walk in and out of surgery, that keeps you safest in terms of reducing all the surgical risks, the blood loss, the blood clots after surgery, and so on. Back to the economics of it all, when you keep patients away from the hospitals, the
Right.
most expensive hotels you've ever stayed at, where you don't get good rest, by the way, because, man, they just have to come in and get your vitals while you're sleeping, right? They wake you up to take your vital
Mhm.
signs while you're sleeping. That happens all the time in hospitals, unfortunately. So when you stay away from the hospital, you save time, you save money. And not only that, when you're limiting your surgery to only one or two body parts at any one time, you're saving money as well, because you're doing a limited amount. You live to fight another day. You come back a few months later, a year, what have you, and then it gives you a chance to reorder your finances. And a lot of patients, doctors love to see, as I do, their patients again for several surgeries. Of
Sure.
course, the prices can go down in those scenarios.
Sure.
So that's a great reason to do ambulatory surgery. And finally, when you do staged surgery, you decide on one body part or two, and you do that. wait a few months, do the other parts. It gives your mind the time to adjust, and
Yes.
for your body image, your perception of how you look, your connection to your appearance changes and adjusts as things move on. Sometimes, people tell me, "Oh, doc, I hate my arms and my thighs," and we end up doing, let's say, a belt lipectomy or a total body lift. They come back 6 months later, and I say, "Okay, what about the arms now? You want to do that?" And then they say, "You know what? Forget the arms and the breasts. I can hide that pretty well. It's my thighs. I love wearing
Mhm.
shorts and skirts, and I need my thighs now. And I just want to get done." They change their perspective. They change the plan. It gives you time to do that.
Right.
So when we're doing these staged procedures, ambulatory surgery, when we're staying away from the hospital, it's the safest surgery we can do. It's the most cost effective surgery we can do. And it's the best surgery that we can do because you end up making the best decisions in your journey into changing your body. Now,
Yeah.
uh, that also goes into all the different aspects of getting surgery done. Uh, in those ways that kind of changed the game on us from the times that I was training in surgery until today, which is when I'm doing almost exclusively ambulatory surgery.
Wow. That really is incredible. When you think about my mom was in the hospital for a week having a child, for God's sake.
Yeah, yeah. These days, those days are over. People actually ask me. They say, "Well, oh, we got what's." I ask them, "What's the most important thing to get after surgery?" They still say bed rest. I say, "No, absolutely not. Heavens
No,
forbid. No
you
way."
need to be up moving for sure.
Exactly. Get up and walk, and I do all kinds of little. I show them little exercises that they can do to, you know, get up and go after surgery. It's the best way to do it.
What do people have to do as far as getting clearances for these ambulatory procedures that you do? Like, do they need clearances from their cardiologist and their pulmonologist?
Yeah, so right, those doctors would be great if they're involved in your care. Of course, that's something I would want to see as a responsible and conscientious plastic surgeon.
Right,
So usually we tell people again. We just spoke about the kind of adjusting when are you ready for surgery. Yeah, it's basically any time that you think that you're ready, and obviously you want to be at your best shape. I always tell people that I want to have you at your lowest possible weight, but not just your starving weight, because I want you to get the most effective, efficient weight loss that you can get, which usually means muscle centric weight loss. So we want you to be building and training your muscles alongside with losing the fatty tissue content in your body, which goes into kind of figuring out what the BMI and so forth of how to assess your ultimate readiness for surgery. But I always tell people that the BMI, well, it can tell us a few things, but I want you at your best physical shape, hopefully with all of the habits, those health habits,
right,
eating right, moving more, things like that, all intact, and having been there hopefully for the long haul. Now, if there are any medical conditions, of course, if you're seeing a cardiologist, a pulmonologist, a neurologist for whatever reason, it doesn't preclude you from having surgery with me. It just puts us on a little bit of a higher alertness, a higher kind of index of suspicion of things potentially going awry. And we have to make sure that those doctors are putting you at the most optimal condition for you to have surgery. The reason why we want that is because we want all of the body's systems, the cardiovascular, the pulmonary, the hematological, the immunological, all to be working in sync and working at their optimized level. If we can see that you're taking your blood pressure medications, controlling your diabetes or impaired glucose tolerance, you're controlling your mental condition. Let's not put that aside. If you're
let's not.
more stable in your body image, you understand. That's another aspect of it. Really gauging the patient's understanding of what it is that what kind of a journey they're embarking with you on. If
Right,
all those things can be optimized and set in their best physical working condition, then you're ready for surgery. And who cares what the BMI is? It's
right.
it's about body composition. It's about mental sanity. And it's that elusive word that you used before, that mindset. If you have that correct mindset of being ready for a big major change in your life, then you're ready for body contouring surgery.
I love that, and I love the fact that, you approach this from a whole person perspective, which is absolutely how I approach it. We are physical beings, we are social beings, we are spiritual beings, we are emotional beings, and so we have to take into consideration all of those aspects when we're doing anything so life altering. And that lifestyle, those healthy habits are so critical in following up a wonderful opportunity like the plastic surgery options that you provide, because you want to maintain that. And like you said, these things can really boost a person's body image, their self esteem, their overall confidence, all of those things. But the lifestyle, the overall whole person lifestyle is so critical in maintaining this.
Yeah, yeah, can't stress that enough. It's
What
it's one of those things you have to kind of keep stressing, and that's why I say, plastic surgeons, we treat obesity. We treat it just like so many of the other doctors that kind of come to mind naturally, like the cardiologist, the hypertension specialist, the diabetologist, and all the others. Yeah, we're intimately involved just because
Yep.
we end up seeing them, for actually quite lengthy periods of encounters. We spoke, just a moment ago about ambulatory surgery and how we like
Mhm.
to stage it. I have multi-year relationships with so many of my patients, which I love
Yes.
because I get a chance to see them flourish and kind of
Mhm.
do that full circle kind of transformation. And then when they keep it off and they keep going for more and
Yeah.
more, and it's just it warms your heart to see it.
It really does, and that's what's kept me in this field for a couple of decades. So if somebody comes to Miami to have their surgeries, their contouring surgeries done with you, what kind of aftercare, what kind of follow-up? How often do they need to see you? How soon after their surgery would they see you?
So everyone has my number. They could call the number and for any emergency, day or night. And sometimes people just need a little bit of a hand holding or just a little reassurance. You know,
Right.
I I make sure that I teach everybody personally on how to manage the drain, even if they tell me that, oh, I'm staying at a recovery house with the nurses, or I hired a private nurse for myself. It's funny. A lot of my patients are nurses, my RNs, LPNs,
Sure.
CNAs, and some doctors as well, MDs and DOs. But maybe they haven't just managed the drain, for quite a few years. So I reviewed with them exactly on what to expect. We review all the issues with the compression garments, the foams, the boards, the post-operative massages. I actually offer those services
Nice.
in-house with my massage therapist. Oh, she's the best. She does it nice and
Nice.
vigorously, and we go through all the different things that you'd have to do. And obviously with every different kind of surgery, there's a different post-operative regimen. But one of the big things that I stress to people in the post-operative care is movement. I make sure, as we said, one of the big elements of ambulatory surgery is that you're moving.
Right.
You're up and about. Even walking that same night after
Yeah.
surgery, I show them all kinds of different little exercises. I'm famous for kind of a not yelling, but let's say urging my patients to circles with the feet, make circles with the feet, and do all those calf raises and then heel kicks and all the different exercises that you
Mhm.
can do at home, in the hotel room, in the Airbnb, on the plane on the way back to Wisconsin or Bahamas or Cleveland or wherever it is, or
Right.
Atlanta, where you are, where people come to see me from. And, I go over all these details as part of the necessary requirements for having this kind of surgery. On the preoperative end, yeah, I talk to people all the time from all over the country. I think so many of them already, I should say, luckily, or thank God, they kind of picked me out already because they've seen so much of my doing
Sure.
my
Online.
daily events on social media. Of course, they've seen all my videos. People tell me that, oh, I've been stalking your page for 2-3 years
I
already,
love
or
that.
or you did it with, you did my cousin, you did my sister, you did my mother, or friends. And
Mhm.
everybody in the salon is talking about you. I had to come meet you. And but listen, I do phone calls, I do consultations online, on the phone, Zoom
Fabulous.
calls, and and I try to help people out. And again, sometimes it does involve me saying, hey, you know what, maybe you're not ready now, but if you're ready for your journey, for weight loss, for health betterment, that body betterment that I talk about, improving your health habits on the daily, minute by minute, hour by hour, if you're ready for that, I'm in. I'm going to be part of your journey wherever that comes, whether it's in the next 2 weeks where we've already scheduled our body lift, or maybe you're not ready, but in 2 years, you know that you're going to be ready for the body lift, the upper body lift, the thigh lift, arm lift, whatever it is.
Mhm.
So it all kind of comes together. You mentioned it a moment ago. I like to take a very holistic kind of approach to it. It's a whole package with me. We talk pre-op, we talk
I
as
love
the
that.
as the surgery is coming along. I actually make little videos, personalized videos for people on the inside, as I
Oh
said.
my
and
gosh,
i
I love
and I
that.
say, hey Lisa, here we are in the middle of your body lift. I'm on the backside now, or I'm on the left arm, I got to go
That is
back to the right
cool.
breast. And yeah, and when they see it, they're just, I let them kind of, they get those videos from me, and that they can go
That's
back and show their
great.
friends. And so, and then in the post-op, everybody has my communication, with me. They see me the next day, they see me in the next several
Okay.
days. Usually people who travel in from out of town, they stay with me for about a week or so.
Okay.
I like it when they stay a little bit longer. It gives me a chance
Right.
to be the doctor and manage any little issue, no matter how big or
Right.
small it could be. And I'm there for my patients to help manage things along the way. Even if you have, less than a week, well, I accommodate to the logistics and finances of people's lives. And
That's
as we
great.
said earlier, getting surgery done, it's man, it's a monumental task in trying to arrange all the life events that have to happen around it. And I really stress for people, you got to be ready, both from a physical sense, from a mental sense. And if you can get your, not only your body and your mind, but your overall life ready for this kind of of a major change, man, I'm there for the ride. It's going to be an awesome ride, and it's my privilege, it's my honor to be part of that journey.
I agree. That is a beautiful way of saying it. I agree. It's a privilege and an honor to be part of people's journeys toward improving their lives in whatever way. So, a quick question about age. What age ranges do you perform surgeries on?
Boy, I span the gamut. I'm telling you. Well, I don't do surgery on children and adolescents anymore. But yeah, people in their 20s, 30s, 40s, 50s, and 60s as well. I think the oldest, I think I probably did a body lift on, maybe I got to look in the archives, a 73 or even a
No
75-year
kidding.
old. Yeah, but that's someone who's, let's say, their teleological age far exceeded their, or was way less, I should say,
Right.
than their chronological age. And it's funny because I have so many patients who I look at their life history, and I see that, okay, they had a bypass in 2018, or they had a sleeve in 2012, and then they were on Ozempic for for a couple years, or then they switched to the bypass, or just diet and exercise. And I tell so many of them, you're going to be a healthier 30-year-old than you were a 20-year-old, or
That's right.
a 50-year-old than you were a 30-year-old. How many people do you know that can say that? And it's just, it's amazing to see the comebacks that people have made in all spans of life. Like I said, young adults, or even mature, middle-aged, or dare we say, elderly people.
Mhm.
It's never too late to make a change in your life. It's never too late to be on that, to start your journey, because every day that you improve your health habits, that's another day, that's another gift for you, because you're doing something to help yourself out. You're doing something to improve the only commodity you get on planet Earth. That's the only thing you got.
That's
It's your
so true.
body, and within your body you have your mind, your soul, and whatever you believe in, and however you tend to
Sure.
view that. It's you, and you only got one you in this lifetime. So that's what I tell people. Look, however young you did it, congratulations. Realize that
Exactly.
it's a lifetime struggle. Okay, if you did the bypass at 28, and it took you 3 years to get to where you are now, be mindful, because you don't want your 30s to be like your 20s were. You want
Right.
them to be even better in the 40s and 50s to improve even
Absolutely.
still.
Yep.
So the age, obviously it's one of the considerations that we always have to look at, but it's not the only thing. And, age is just a number. Well, yes and no to that one.
Right. Absolutely. I agree. One final question, and that is about pain medications because people who have had bariatric surgeries most often cannot take any NSAIDs. So, how do
Yeah.
you manage pain?
Right. So just the if whoever's watching, if they don't know, so NSAID stands for NSAID, which is the non-steroidal anti-inflammatory drugs. Obviously, what you would know is ibuprofen, Aleve, just to make that clear, or aspirin. It's
Aspirin.
closely related there. But
Mhm.
yes, and a lot of people who've had the sleeve surgery, whether it's an endoscopic sleeve or the actual bariatric surgery sleeve, so they do have some issues there. So we can talk about that. I always prescribe a limited amount of opioid pain medication. Sorry, folks, it's the best we got. It's the strongest pain medications that we got,
Right.
albeit with a bunch of unwanted side effects. But that's one of the reasons why we're very limited in scope into what we can
Correct.
administer, what we can prescribe to people. And so, I'm known for being very stingy with that kind of those kind of
Good for
medications.
you.
Yeah, I mean, I have to just because
Yep.
I'm one of those doctors that actually ends up prescribing a whole bunch of it. So the state keeps an eye on me, and as well they should. And that's one of the things that I do. But I don't only give that. I make sure that people can work with other kinds of medications like Tylenol, like the
Right.
NSAIDs if they can take those, of course, like some of the neurotropic medications like gabapentin and
Right.
Lyrica. Some of the, there's plenty of plastic surgeons who make that standard parts of their post-operative pain regimen. Also, muscle relaxants, and
Right.
people have asked me for those as well. I'm not opposed to doing that as long as I review their medical history and make sure that we're not getting any interactions with some of the medications that we give you intraoperatively or during the OR. And one thing that I actually love to do is use a medication called Exparel. Now, that's one of those those local anesthetics that falls into the cane family, like lidocaine and bupivacaine. It's in the part of the family that is a long-lasting aspect. That's the its mechanisms of action is long-lasting, but Exparel specifically is formulated in a way that it's a long release into the system, so that it's a medication that I can actually inject, and I usually inject it into what we spoke of earlier in that muscle repair or the diastasis repair, which would be the deepest area of work that I would do. Let's say, for example, on a tummy tuck or body lift, and that's usually the source of most of the potential pain and discomfort that you would experience from this kind of surgery. So I actually inject that medication routinely there and also around the incisions, so that we supply a patient with the pain medication that's long lasting
Nice.
and formulated as a slow release. So it's there being released for the next 3, 4, or even more days post operatively. Now, that allows the patient to move better and
Mhm.
quicker
Mhm.
after surgery, which again is the essence of ambulatory surgery. And most importantly, it allows the patient to reduce their need for the post operative
Right.
opioid pain medications,
Love
therefore
that.
reducing on the potential untoward side effects that we have along with taking them. So and let's not discount also being prepared, being mentally ready for the kind of surgery, and limiting the fact that we're only doing one or two body parts. All those things go together into creating an individualized, personalized pain management plan for every patient. And a lot of people tell me that it's funny. Oh, doc, I'm okay with all the surgery. It's just the anesthesia that I'm so scared of.
That's
And
true. I'm
we
glad you brought that
yeah, and
up.
and part of the effort, and again, it goes all along with the preparation, the mental preparation, and the pain management of it. Part of doing all that is making sure that you have a great anesthesia team that's working on you, that
Right.
works with the doctor. Maybe another one of those things that you gotta among the multitude of other things that we've discussed already, about the things that you have to be ready and prepared for, and be get yourself to be as knowledgeable as you can of a consumer for this kind of healthcare. So lots to say about anesthesia and pain management, maybe a little bit more than the scope of this discussion, but be happy to talk about that some more.
I love how thorough you are. I love how enthusiastic you are. I can tell that you absolutely thrive when you see people succeeding and doing well. It is a joy to talk to you, and I am so excited for people to hear this because you've explained things. I've been in this field for 2 decades, and you really did an amazing job of explaining this and
Thank you.
comforting information like this is feasible for everybody in their journey, and it can be so helpful mentally, emotionally, and toward your long-term success overall.
Yeah, yeah, absolutely. That's why I keep saying plastic surgery is healthcare. You know, there's so many
It is.
naysayers and detractors out there. Oh, it's just vanity. You're doing this
No, it
because
is
of
not.
one reason or another. Yeah,
Mm-mm.
you won't hear any of that from me. I'm the biggest cheerleader for plastic surgery, and partly because of the work that I do, because I see what an incredible part of people's weight loss and health maintenance journey that my role could be in it. I'm telling you, it's just and I'm glad. I'm so glad. Thanks for inviting me here and
You're
on this forum to
welcome.
talk to your viewers, your listeners, because as we touched on it earlier, as good as we've become, as available as it is today, this post massive weight loss, body contouring, plastic surgery, as much as there is of that today, we are still vastly underutilizing the effect of this kind of surgery. So many people could benefit from it. So many people could just improve everything in their every aspect in their life, and just get to better health, improving the quality of their lives, the longevity of their lives, and talking about it, doing the very things that we just did today. That's that we're taking a great step towards that. So thanks to you, Dr.
Yes,
Stapleton, and thanks for everyone listening and watching for to get the message out
absolutely.
there.
I will have all of your contact information in the show notes, but if they just Google Dr. Kaufman, plastic surgeon, Miami. That'll get them to you immediately, correct?
Yeah, so you can find me. I'm all over the internet, but you can get. I mean, the easiest way to get to all my different socials, you can go to drdanielkaufman.com. That's DrDanielKauF as in Frank, MAN. All one big word, no periods, no underscores. drdanielkaufman.com. That leads you into my Instagram pages, my TikTok pages. I have a few out there. You can see so many of my before and afters out there. You can find me on some other talking about not only about plastic surgery, but all things health related. Again, I have a passion. I'm glad you noticed it. I appreciate that. I have a
Sure.
passion for weight loss, for treatment of obesity and all its comorbidities, and for just health maintenance in general, developing of those health habits, those daily health habits. And I talk a lot about mental health and that elusive
Excellent.
mindset reset that you gotta have in order to start your journey and continue on it. So there's lots of things that I talk about online. Feel free to look me up. I live and work in Miami, the best city in America, the
Well, I'll tell
best
you what,
weather. The
if any of our
uh-huh.
listeners wants to go through with some body contouring with you, I want them to work with both of us, and we'll do a continual ongoing podcast series with them as they go through this process because I would love for other people to hear how amazing this can be for
I would
them.
love to do that. That would be great. Yeah,
I
personalized
don't know, wouldn't
stories.
that be fun?
It would be amazing. It's funny. These days, people are just so much more willing to share in their journeys. I mean,
Yes,
you could see so many people making just viral videos online showing these incredible transformations. And it's funny because it happens so quickly on a 30-second TikTok video. But those of us who are on the inside, fighting in the trenches on a daily basis, talking to our patients, people like you and me, absolutely, we see just how hard it is. We know what kind of
mhm,
adversity, what hardships those patients have experienced and are
that's
still
right.
experiencing in their daily lives. And I would love to share. Absolutely. I'd love to be part of this. Yeah, any way we can talk more about this kind of stuff, I'm all in.
I love the idea. All right, you heard it. You can be the one. So get in touch with us. But thank you, Dr. Kaufman. Absolutely a pleasure, and I'm sure we will talk again.
The pleasure's mine. Looking forward to it.
Uh, Thank you for making the time. All right. Take care.
Take
Bye bye.
care.